Welcome. My name is James Frickton. I'm a professor emeritus at the University of Minnesota, work for Health Partners Institute and the Minnesota Head and Neck Pain Clinic. I am an orofacial pain specialist and have been working in the field for the last 40 years. So I wanted to give you some brief view on this course on management of orofacial pain specialty practice. And so, as you know, the National Commission on the Recognition of Dental Specialties and Certifying Boards has approved our specialty, orofacial pain, as an official dental specialty. And as you know, our specialty and practice of dentistry encompasses the diagnosis, management, and treatment of pain and sleep disorders of the jaw, mouth, face, and associated regions. So what I want to do is to convey to you how to build a successful clinical practice in this new specialty of orofacial pain. So today, I'm going to just briefly talk about what I'm going to talk within the hour-long lecture. And we'll focus on four areas. One is the opportunity, which includes the prevalence, impact, the opioid crisis, and the need to expand dentistry. And I'll talk briefly within this promo. And then we'll talk about the barriers to successful orofacial pain practices, health plans, and other issues. And I'll talk about what are the best practices around the country to improve access to care, as well as the best practices to improve success of orofacial pain practices. So let me talk briefly just about the prevalence. When you look at the epidemiological studies on orofacial pain disorders, if you include headache disorders also, that what we find is about 30 to 40% of the entire population has an orofacial pain disorder, including TMD problems, burning mouth, neuropathic, atypical facial pain, headache disorders, orofacial sleep disorders, neurosensory and chemosensory disorders, and oral motor disorders also. So there is a tremendous opportunity for clinical practices that are successful in this area. But it's also important to recognize that the dental diseases that we traditionally treat within the practice of dentistry, general dentistry, are also declining over the last 10 to 20 years. So for adolescent dental caries, for instance, decreased by 20% in the past 20 years. Adult caries has decreased by 30%. Periodontal disease has decreased by 50%, and missing teeth by 40%. So all of this means that dentistry as a profession has to move into the orofacial pain area, and we need to expand clinical practices. We need all dentists to understand these, but we definitely need specialty practices to really grow in each state of the country. So there is an estimated need for orofacial pain specialists in the United States. If we look at 30% of the population at 100 million people, we currently have only 250 people in practice. So with that population, that's almost $400,000 per specialist, way more than what we can handle. So the estimated need, like oral surgery, is about 10,000 more specialists. And a survey of 405 health professionals, including dentists as well as physicians in the Midwest, found that 95% want to refer these patients with persistent pain to an orofacial pain specialist due to their complexity. So all of this bodes very well for the practice of orofacial pain. So join us in the future within this course. Thank you.